When I was a medical student and I was working in all the departments, I would always ask women who would come for antenatal care, why did you come? And they would always say, so that my baby would be fine. And it went on, and not a single woman told me that I came for myself. And it was always the other way around. And it was a very strange kind of a bond that I thought that should be protected. And my calling belonged there. And that's why after my post-graduation also, I chose the field of obstetrics as my area of work. And that's how it has continued, and I still enjoy it. The scale can never be on one side. You can never be a professional completely, or you can never be a friend alone as such when you are in this journey. Sometimes you have to take decisions as a professional, sometimes you just have to support her as a friend. So the scale keeps on moving from one side to another side. And yes, I can tell you, after the journey ends with the birth of a baby, and many of them will become your friends and they stay with you connected for a long, long time. In medical field, empathy and compassion should be a must if you want to care for people. Skills are important, knowledge is important, experience is important. But if these 2 points are lacking, then the care becomes a kind of a journey that is not very enjoyable. My journey at Fernandez has been phenomenal, or if any junior wants to think how do you go up the ladder, then you should see how I've grown up here. And the credit goes to entirely the Fernandez Foundation team, the core team, Dr. Evita as such. So it's 10 years now. And we wanted to make it a kind of a institute which would be parallel to other countries, to UK, and we would go out and come back and see what's lacking here and put it back. But it has been a very meaningful journey. I think Fernandez molded me to what I am today, and I hope I'm a better person. When you ask me a specific question, a story comes to my mind which is very strange. And I connected with this couple for a very short time. They were referred to us pretty late into pregnancy, and we thought that the baby was very small, and we felt that she needed to undergo a cesarean section. We did the cesarean section, and the baby came out to have multiple anomalies of the face, of heart, multiple abnormalities. And it is very shattering to the couple. It was shattering to us also. We did not expect it. They did not expect it. It was difficult for them. So the next day when I went for rounds, the nurse told me that mother did not want to see the baby. Okay, the baby was in the nursery. So I went and spoke with her. I thought it must be so difficult for, if I was in her place, it would have been very, very difficult to walk into the room and see my baby. So I spoke with them, and years later, the father connected with me on a WhatsApp. And he sent a series of images of that baby who had undergone multiple surgeries and was looking normal, absolutely. And I couldn't believe that they have worked so much onto that, on that journey, and then connecting me years later to tell me, take a look, Dr. Nuzhat, this is the baby that you delivered at that time. And he kept in touch with me very, very rarely, but it was there. And once we were having a conversation, and he said that we will always remember the words you said. And I was like, did I do anything wrong? Did I say something wrong? And I'm known for it. And he said that you used the word, your baby must be waiting for you. And we felt that it was a responsibility that we had to take. And we will always remember. I've been trying to remove negative words from my vocabulary, because it was not a brilliant sentence or a great sentence or not a quote. But it just showed you that, some good words, some positive words, you never know what they mean to the other person. I think till 12 I used to be here. I would hardly go home, only to sleep. Nowadays, I'm trying to take out time. I call myself an artist first, and then as a profession, an obstetrician. So I have managed to pick up my paints, and I love painting. That I like Maggie and McDonald's. All right, so if you want some dirty work done by me, you have to give me a combo. It works for 4 to 5 hours. That's my mileage. I would have been an artist, no doubts about it. No, a designer maybe, something else, but yes, lot of painting or an artist part of it. It's what I try to put in everywhere that I can. I'll go back to it once I retire.